So decoy-resistant IL-18 is a modified version of the naturally occurring cytokine IL-18. And initially was developed by Aaron Ring's group at Yale University. And IL-18 is generally thought to be a pro-inflammatory cytokine capable of stimulating innate lymphocytes, antigen-experienced T cells, among other effects. And for this reason, IL-18 has been tested previously as a potential anti-cancer therapeutic. And while it was known to be safe and well tolerated, it seemed to lack efficacy. And it was known, IL-18 was known to induce the secretion of a high affinity binding protein called IL-18BP, or IL-18 binding protein. So what Aaron Ring's group was able to show was that this IL-18BP was functioning as a secreted checkpoint inhibitor, blocking IL-18 naturally occurring activity. And so they were able to develop, through protein engineering, a resistant form of IL-18, so hence the name decoy-resistant IL-18 or DR18, that had still had the ability to stimulate immune cells and have that pro-inflammatory effect, but now was resistant to IL-18 BP activity. And they were able to show very nicely that this had preclinical activity in mouse models of other cancers, so melanoma and colorectal, to name a couple. And then they went through and showed some of its mechanism of action. So we were very interested to test this compound, this DR18 or decoy-resistant IL-18 compound in renal cell carcinoma. And we thought there was a high likelihood that it could have efficacy here. Because renal cell carcinoma is known to be immune responsive. Immune therapies have been used in renal cell carcinoma for a number of years, including high-dose IL-2 in the 1990s and interferon alpha, and also now the more modern checkpoint inhibitors are a backbone of standard of care therapies for renal cell carcinoma. So we thought for these reasons, an immune stimulating agent like DR18 could be effective here. But we also did some additional work showing that the IL-18 pathway may be poised for reactivation in renal cell carcinoma. We saw high levels of IL-18 BP expression, mRNA expression, and also high levels of the IL-18 receptor expression in clear cell renal cell carcinoma. And that is the predominant histology of renal cell carcinoma that we see. And so among, let's say, 29 to 30 cancers that are present in the TCGA Pan-Cancer Atlas, our clear cell RCC had among the highest expression of the IL-18 blocking protein and the receptor. And we also saw that higher IL-18 BP expression was associated with worse overall survival and also correlated with worse response to immunotherapy. So for these reasons, we thought the combination could be, or the compound DR18 could be very effective. So we want to test this in preclinical models. Now, while we chose to combine it with CTLA-4, that was a bit of a surprise, actually, why that combination works so well, or the fact that combination works so well. We tested DR18 in combination with both PD-1 and CTLA-4 blockade in two preclinical models of renal cell carcinoma, expecting that we would see some additional benefit, maybe not so much from CTLA-4, but from one of them. And to our surprise, we actually saw no additional benefit when we combined DR18 with anti-PD-1. But we did see, significant benefit when we combined it with CTLA-4 in both our mouse models. So that was a bit of a surprise to us. So further work we did was delving into why this was the case.